Hey everybody, I wanted to jump in here. I'm on a quick lunch break. I get asked a lot about anxiety and pain, and is this a panic attack? I get asked because people say there's nothing I can do to control my pain. I need something for anxiety. I'm always anxious about my pain. Well, it's true. Pain is a four-letter word. I get that. However, situational anxiety and depression are different than panic attacks. And what we got to do is differentiate the two and find out what caused it, and then what can we use to treat it? Well, can't you just give me some medicine? I just need some medicine. I can't sleep. I need my Xanax or Aprazolam. I need my Valium or diazepam. Well, the American Psychiatric Association, Canadian, European, considers no clinical indication for benzodiazepines in that type of situation. It's also probably not a good choice for PTSD and a lot of the other common reasons we dispense benzodiazepines. Benzodiazepines are a drug that I think is underwhelming in risk. I don't think folks realize that it's habit forming, really habit forming. And I'll ask folks for their medication. They'll say, can I see your medication? I need to count your medication. Well, I left my pain pills at home, but they always have their benzodiazepines in their pocket. So how long have you been on that? 5 years, 7 years. I really need it for sleep. Benzodiazepines interfere with sleep architecture. They interfere with memory. Now, we don't need that because pain interferes with sleep through alpha-2 intrusion. You never get to that deep sleep, that REM sleep, which helps with memory, refreshing sleep, with just getting through the day better. At the end of the day or midday, I'm just beat. Well, if you get to good sleep and you have good sleep, all ships rise. Your pain gets better, you get through the day, better quality of life indices, activities. That's what we're all about when we treat folks in pain. Now, the primitive part of the brain, right behind the ear here, that's where pain, addiction, and depression are processed directly and indirectly. So what we want to do is we want to come up with the strategy to first properly diagnose. Is it panic, or is it situational depression and anxiety? What is the severity? Where did it come from, and what can we do? So, diagnosis, all right? Rule 2, must have a diagnosis. All right, anxiety is common. People that say they don't have anxiety sometimes are not being factual with themselves. We all get anxiety, everybody does. Sometimes you get a little bit of chest pain. Sometimes your throat feels constricted. Palpitations, you feel it coming and then going and coming. It tends to be prolonged. It keeps coming and going, keeps coming and going. It has a long track, and it doesn't just go away. Panic tends to just go away, unless you have paroxysmal moments where it just keeps coming back and coming back. That's something different. So, the difference between anxiety is this prolonged feeling of sadness sometimes helpless, hopeless, getting on the lines of depression, right there at that line, versus panic, where it tends to come on, tends to go away. It really is scary because people feel a sense of doom. They feel that I can't do anything. They just become helpless, hopeless. So there's a true delineation, and a healthcare provider has to help you with that stuff. Take notes when these things come on, and it's likely most times it's just going to be some situational depression, anxiety that can be treated with choices. Well, of course, cognitive behavioral therapy, a number of non-pharmacologic approaches, but we also have to look at getting the right diagnosis, because a lot of anxiety is associated with mental health problems such as bipolar, alcohol, drugs. It can be caused by trauma, life's events. So we have to get a handle on triggers. And in this era that we are in right now, that word trigger is a naughty word, but it's true. There usually are triggers for both. And we have to learn to manage them. So is it anxiety? Probably. They say female more than men. I don't see that. Is it associated with pain? All the time. Anxiety is associated with pain virtually all the time. Anticipation of pain, anticipation of more painful events, poor sleep, poor control. Am I going to get my medicines? And inactivity. Get moving. Exercise helps them both. Getting any kind of exercise. Just walking. I've got folks out here walking now at noon. It's such a beautiful day. It's ending the North Carolina winter, which is a good time of year. So I just wanted to jump on real quick and talk about one of the most important discussions I have with folks, and that is no risk to harm self or others. We got to be clear on that. If you feel suicidal or you feel like harm to yourself or others, sure, it goes without saying. But if it's not asked, sometimes that answer doesn't reveal itself. And we don't want surprises. I don't want them for you. And we can get through this. Benzodiazepines, not so good. Talk it over with a healthcare provider. Remember, pain, addiction, and depression share many of the neurobiological foundations. They're right there, primitive part of the brain. It goes to the prefrontal cortex. And it can interfere with judgment too. So if you think things are a little out of control, you have options. Get your diagnosis right. Comorbid problems, if you've got some other medical problem or triggers. If you've got a substance abuse problem, you've got to get that under control. So anxiety and panic, they're two different things, but they aren't far apart, so I can understand the confusion for some people. Dr. Google's a bad source of information. You really got to have a healthcare provider for this one. So keep track of your symptoms, keep track of your health. God bless you all.